For many years, people have been terrified of cholesterol. You may have been told that eating eggs increases your heart disease risk, or that all cholesterol is harmful and must be removed completely from the diet. But what if I told you that many of the things you believe about cholesterol are completely wrong? What if the real danger is not cholesterol itself, but the myths that force us to make unhealthy decisions? Today, we will uncover the truth that can protect your heart and your life. Namaste. I am Dr. Ayer Mulam. In this video, we will clear the biggest misunderstandings that people have carried for decades about cholesterol. This topic matters because heart diseases are increasing at a worrying rate in the world, especially in India, due to our lifestyle changes. Cholesterol is often blamed as the villain, but the truth is more complex. Some cholesterol is essential for hormone production, digestion, and even brain functioning. Yet, due to misinformation, many people either avoid the wrong foods or take unnecessary stress. By the end of this video, you will be able to differentiate facts from myths and make the right lifestyle choices to protect your heart health. High cholesterol does not show early symptoms. It quietly builds up in the arteries for years without giving any pain or visible signs. When symptoms finally appear, the condition is usually advanced. People may experience pressure or pain in the chest, fatigue even after light work, shortness of breath, dizziness, or a feeling of tightness in the jaw or left arm. Sometimes, small yellowish lumps appear around the eyes, which are fatty deposits. In a few cases, heartburn-like discomfort or sudden blackouts may also occur. But the absence of symptoms does not mean cholesterol levels are normal. This is a silent condition that needs timely screening rather than waiting for warnings. Cholesterol travels in the blood attached to proteins called lipoproteins. LDL is often labeled as bad cholesterol because it can stick to artery walls, forming plaques that narrow the blood vessels. HDL is known as good cholesterol because it helps remove excess cholesterol from the arteries. The balance between these two is what matters most. When lifestyle becomes unhealthy, LDL rises and HDL drops, creating the perfect environment for plaque buildup. Excess sugar, processed food, smoking, and alcohol trigger inflammation inside the arteries, which makes plaque formation faster. Genetics also plays a strong role. Even thin people can have high cholesterol if it runs in the family. Ayurveda teaches that heart disease happens when there is accumulation of ama, meaning toxic waste, due to weak digestion and poor metabolism. When vata becomes imbalanced, the movement of blood becomes irregular. When kapha becomes dominant, heaviness and blockages develop in the arteries. A happy heart needs balanced bodily energies, strong metabolism, pure blood, and a calm mind. The theory of dosha imbalance beautifully supports modern science, which shows that stress itself can raise cholesterol and damage heart health. Diagnosis is simple and must not be delayed. A lipid profile blood test measures LDL, HDL, total cholesterol, and triglycerides. This should be done every 6 months if risk factors exist such as high blood pressure, diabetes, obesity, or a family history of heart problems. Sometimes doctors also check liver function and thyroid levels because these conditions strongly influence cholesterol metabolism. It is important to consult a doctor immediately if cholesterol levels remain high after lifestyle modifications or if symptoms of heart stress appear. Prevention begins with knowing your numbers. Treatment begins with removing myths and making informed dietary choices. People often believe that all fats are bad, but the truth is that healthy fats protect the heart. Foods like nuts, seeds, olive oil, and ghee in small quantities support good cholesterol levels. Fiber-rich vegetables, fruits, and whole grains help reduce LDL naturally. On the other hand, spicy processed food, deep-fried items, excessive sweets, and artificial trans fats increase the risk. sugar is more dangerous for cholesterol than natural fats. Hydration also supports smooth blood flow and better metabolism. Exercise plays a powerful role because physical movement increases HDL, the protective cholesterol. A simple 45-minute brisk walk daily can bring remarkable improvement in heart health. Yoga and breathing practices keep stress levels low, which prevents sudden cholesterol spikes. Maintaining a healthy weight and reducing belly fat are essential because visceral fat acts like a chemical factory producing harmful hormones that worsen cholesterol balance. Medicines like statins may be required when numbers are high or when there is a strong family history of heart disease. Supplements like omega-3 fatty acids may help reduce inflammation and support heart health. Ayurveda offers herbs such as Arjuna, Giloy, and garlic, which help in improving circulation, cleaning toxins, and strengthening heart muscles. But medications must be taken only under medical guidance based on the individual's health condition. Lifestyle changes are the backbone of cholesterol management. Avoiding smoking, limiting alcohol, fixing sleep routines, and managing daily stress are crucial. Emotional balance is equally important because a peaceful mind keeps the heart and metabolism in harmony. Even habits like laughing more and spending time in nature are now scientifically proven to protect heart health. Prevention is more powerful than cure when it comes to cholesterol-related conditions. A heart-healthy daily routine with balanced meals, regular exercise, mindful relaxation, and periodic health checkups can save years of trouble. People should not wait for discomfort or pain to start caring for their cholesterol. Knowing your numbers, maintaining healthy habits, and taking early action can ensure that you stay active and energetic, even in later years of life. Prevention begins with awareness, followed by small daily corrections that lead to long-term health benefits. Thank you for watching this video. I hope the truth you learned today will help you make better choices for your heart. Please like, share, and subscribe so this knowledge can reach more families and protect more hearts. If you want me to cover any other lifestyle disease, or if you have a personal doubt, write it in the comments below because I read every comment and try to guide as much as possible. You deserve a healthy heart and a healthy life. I am Dr. Ayurmulam, and I will be here again with more helpful videos to support your well-being. Take care and stay heart healthy always.